Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Shiba Akram, gynecologist. Today we are going to talk about the largest organ in the body, and that is the skin. We are going to discuss the changes that appear in the pregnant woman during pregnancy in their skin because they are greatly concerned with it. The incidence of these changes is round about 90 to 95%, and they are because of the hormones, especially melanocyte stimulating hormone from the placenta. And the recent studies have shown that estrogen and progesterone, they also play their role in these skin changes during pregnancies. You know, we want to know what are the sites where these changes appear. Firstly, on the face, and then on the breast, on the axilla, on the abdomen, on the inner thigh, and perineum. So these are the 6 sites where mainly these skin changes appear during pregnancy. On the face, we note two types of pigmentation. Firstly, melasma, which is a butterfly type of pigmentation because it appears on the forehead and it appears on the tip of the nose and on the chin. So it gives the appearance of a butterfly. In 80% of the cases after pregnancy, this melasma is gone, but in 20% cases, it remains over there and needs to be addressed. Melasma can also occur in the non-pregnant state as well. And the second thing that happens in pregnancy is cholasma, and it happens only in pregnant women, not in the non-pregnant state. It's a sort of pigmentation which appear in the form of a mask because it covers the forehead, it covers the upper lip, and it covers the chin. So it covers the face like a mask. So it's also called the mask of the pregnancy. Again, it disappears in 80% of the patients after pregnancy, but in 20% it remains and needs to be addressed. So this much is about the face. Now we come to know that on the axilla, the skin gets very dark, and it's again because of this melanocyte stimulating hormone. And the Montgomery glands on the breast, they are basically the sebaceous glands, and these sebaceous glands, they secrete excessive oil to moist the skin, which is very important. Otherwise they get dry and they get cracked, and we often found the patients who complain about these cracked nipples and they need to be addressed. Then comes the abdomen. In the abdomen, what happens that there is a black line of pregnancy which is called linea nigra. It stretches mainly from the umbilicus to the symphysis pubis, but in some cases it extends from the xiphoid sternum up to the symphysis pubis. So it's quite a long line in some patients. The second thing which is common in the abdomen is stria gravidarum. This stria gravidarum, after pregnancy, they look like the silvery lines. Why they appear? Because the abdomen stretches to a maximum extent during pregnancy. When the abdomen, baby in the uterus, it increases in size, the abdomen gets stretched, and the elastic fibers and the collagen in the skin gets, overstretched, and its elasticity is gone, and these stria gravidarum, they appear on the abdomen. But on the inner thighs, this stria can also be seen because they also get increase in size, and pigmentation on perineum can be noted as well. Now the question arises, what to do, how we can tackle these skin changes that appear during pregnancy, because not only these things but sometimes acne and hirsutism is also there. But after pregnancy, this hirsutism is gone and its incidence is very low, it's just 10% in pregnant women. What we need to do first and foremost thing is our in management is our diet. Keep the skin hydrated and take good quality of diet, including honey, curd, milk, fruits, especially citrus fruits which are rich in vitamin C, and vegetables. Do include these things in your diet, and proper sleep has no alternative, and avoid the stress. These things are very important in the management of skin changes during pregnancy. And then what we can do, we should cleanse our skin but never Never use excessively the soaps because they make the skin dry and irritant, and when you repeatedly scratch, the strias get deep and they stay lifelong otherwise. So uh, soap should not be used very frequently, and we need to moisturize the skin, and we should use the natural moisturizers. Natural moisturizers include coconut oil and almond oil and olive oil. They are the best non-irritant natural moisturizers that can help the skin. And then for these pigmentations, one thing is very important, and that is the use of sunscreen. Always use the sunscreen when you expose yourself to the outside the home, and always avoid the scorching sunlight. Avoid that sun rays, so that your pigmentation is not very much enhanced. Then what we can do about these skincare, we should always clean the skin very properly, and we should hydrate it as we priorly told, and we should moisturize it, and we should apply the sunscreen on it. So overall, I have summarized this management, I mean, as far as these things are concerned. But these are the do's. There are certain don'ts, what we should not do. We should avoid the things, we should avoid the creams or gel which contain salicylic acid and essential oils and retinoids, because these are skin irritants and they especially irritate the skin during pregnancy. So please avoid them. And as far as essential oils are concerned, they sometimes react very overly on the skin. So these things should be avoided. These were some tips that could help a pregnant lady in taking care of her skin during pregnancy. With this, I would like to say use them and take these precautions and stay safe and spend a very healthy and sort of very good sort of life. Thank you.